Our Constitution begins with three simple words: we the people. And the founders wrote that in supersized font to remind us that this is what our nation is all about. It's not about power by the privileged. It's not the elite. It's not make the wealthy wealthier. It's not add more to the abundance of those who already have much. It's to establish government that reflects the will of the people, or as President Lincoln put it, of, by, and for the people. But in this age, where vast sums are spent on campaigns by a few billionaires to basically substitute of, by, and for the people, government of, by, and for the powerful, we have an enormous challenge to maintain the integrity of the mission of our Constitution and the responsibility of this U.S. Senate. We haven't probably seen a challenge to we the people in years like the equivalent of Trump Care, certainly designed to plan for massive tax giveaways to the wealthiest Americans, hundreds of billions of dollars, and to rip health care away from 20 to 30 million ordinary working families. What a travesty of our responsibility under our Constitution. What amazingly misguided effort to do damage rather than to assist and provide a foundation for families to thrive. A few years ago, a woman came up to me at a fundraiser for multiple sclerosis, a walk, and she said, "Things are so different this year, Senator, than they were last year." And I asked her, "How so?" And she said, "A year ago, if our loved one was diagnosed with MS and they had insurance, they were likely to have an annual cap or a lifetime cap and run out of coverage. And that was a terrible situation to be in because MS is a mysterious and expensive disease." And she said, and if the individual didn't have insurance, they now had a pre-existing condition and they wouldn't be able to get insurance. She said, now we have the peace of mind that if our loved one gets an MS diagnosis, that individual will be able to get the care they need. Isn't that just the summary of what we should be seeking in our healthcare system? The peace of mind that if our child or our loved one becomes ill, if our child or our loved one becomes injured, he or she will get the care they need? Shouldn't that be what we're fighting for? But instead, we had the opposite. We had the Trump Care bill, designed to rip peace of mind away, destroy peace of mind, trample all over peace of mind so that the wealthy could have more giveaways from the federal treasury. Well, we had that House bill, and that was an estimated 23 million people would lose health care over 10 years, and that our hospitals and our clinics would have a lot less funding to be able to provide care to everyone. And yet it passed the House, and then President Trump got briefed on what was in the bill after he'd held this champagne party at the White House to celebrate its passage. And he said, "Oh, wait, this bill is mean and heartless." So then over here in the Senate Secret 13 went to work to try to produce a bill with no public hearings and no discussion with stakeholders, secreted away in a room where no one could find out where they were to offer any insights. Didn't hold any town halls back home, no meetings here, public totally blocked out. And the Secret 13 amazingly came up with almost an identical bill to the House bill. Oh, the estimate was maybe instead of 23 million people losing insurance, 22 million people would lose insurance. Well, fortunately, the Secret 13 bill was defeated, but just barely here in this chamber. And then came another version of this called the fake insurance bill. This fake insurance version said that, hey, let's let the insurance companies put out policies that are really, really cheap, but don't actually cover anything. Won't that make us feel good that everyone in America can afford a policy that only costs $40 or $50 per month? Of course, fake insurance is fake. That is, when you go to the emergency room, it doesn't cover the visit. When you get a blood test, it doesn't cover the blood test. When you need an X-ray or an MRI, it doesn't pay for it. Oh, and don't even begin to think about it covering hospitalization or any other normal medical service because it's fake insurance. Well, the fake insurance bill failed by a few votes here on the Senate floor. And then we had repeal without replacement, and that failed. And then we had the skinny bill, and that failed by a single vote. How is it possible that we came that close to passing a bill that's completely the opposite of the vision of our Constitution, to legislate for the foundation for the American people, not the American privilege, not the American powerful, but for the American people, and yet came within a vote of passing? And then this week, we have the block grant version. Block grant version that proceeds to destroy the exchanges immediately, the healthcare marketplaces. And of course, the great irony here is that was the Republican idea. Let's create a marketplace where people can compare individual policies, pick the one best for their family, and get tax credits to be able to buy them. So the Republicans came out against their own plan. Well, in addition, it wiped out Medicaid expansion. My home state of Oregon, the exchange is responsible for roughly another 100,000 people gaining access to insurance, the marketplace, and 400,000 people gaining access through Medicaid expansion. So there's 500,000 Americans in just my state, my humble state of Oregon. And yet here was a bill saying we don't care, we're going to wipe out health care for 500,000 Oregonians and untold millions across the country, 20 to 30 million across the country. Well, we owe a big thank you to Grassroots America. We owe a big thank you to ordinary citizens who believe in the vision of this country. And they proceeded to connect with Capitol Hill, to fill the streets, and to flood the phones, and to overflow our inboxes, saying, "What are you doing? Please stop. Please stop trying to destroy peace of mind for Americans." They said, make health care work better, not worse. Is that really too much for us to ask? And as we ponder how to make health care work better, Grassroots America has expressed a lot of ideas. They've said, we have a really complicated system that creates all kinds of obstacles for ordinary families, for working families. For example, consider whether you have a job that provides you with insurance and your family with insurance, but then the company changes the policy. It only covers you. How are you going to get your children covered? Are you going to be able to get them signed up right away for the Children's Health Insurance Program? How do you go about doing that? And then your employer says, by the way, you now have to start paying us in order for us to provide you with health care. And you go, wow, that's a huge chunk out of my check. Can I possibly afford that and still pay my rent? Am I going to have to choose between health care and homelessness? Not a choice families should have to make. And then perhaps someone's working several part-time jobs. The employer has no health care program at all, and they sign up for the Oregon Health Plan or the equivalent Medicaid plan across the country. Well, they like that, but it's complicated to apply, and they have to reapply periodically. But then what happens if their income goes up just a little, and now they are over the line for eligibility? And as a result of being over the line, they now have to go back into the individual market. And how do you do that in the middle of the year when it's not an open enrollment period? Such complexity, such difficulty. That's why it's so appealing to think about the vision of a seamless, simple health care program that you have that will provide health care, quality health care when you need it, affordable health care, just by virtue of being an American. That's a beautiful vision, and it's not out of reach. Every other developed country has found some version of that and made it a reality. And we need to ponder how to have that seamless, simple system down the road. But right now, we have a more immediate task. And that immediate task is to stop the sabotage of the healthcare system we have. President Trump has engaged in many maneuvers to try to force the collapse of the insurance markets. One is to withhold the cost-sharing payments from insurers so that the funds that they were promised they no longer have. And that uncertainty has caused many companies to say, don't count on us to be in that market in the future if we can't count on you, the federal government, to honor your obligations. Why isn't this body, the Senate body, demanding that the president honor the obligations with those cost-sharing payments? And in addition, we have the president shutting down advertising during the open period so that people won't know that they can sign up. In addition, we have President Trump cutting the enrollment period in half. We have a plan now from the administration to cut the funds for consumer outreach and enrollment assistance that enables folks who need to get health care to find out how do they actually get through the complicated application process. And most recently, the administration announced it's actually going to shut down the website periodically during the open enrollment period. On weekends, when people have the time and effort or ability to apply, they're going to shut down the website so that people won't be able to apply during portions of the weekend. All of us should unite. 100 senators should unite and tell President Trump enough of this sabotage. You want to drive up insurance policies by 20% over any other increase they might otherwise have? You want to be responsible for millions of people not gaining access because of your irresponsibility? Then we're going to hold you accountable for it. Everybody in America, grassroots America, is going to hold you accountable for it. Fortunately, we have a bipartisan process that was underway to take and work together to remedy these conditions. And I profoundly thank Lamar Alexander, chair of the Health Committee, and Patty Murray, the ranking Democrat on the Health Committee, for saying, let's have the normal, rational process that we go through to try to understand how we can improve the health care system. And so they held a series of hearings. They brought in the experts. They brought in the stakeholders. They did it in front of the public so the public could weigh in. They consulted constituents, encouraged all of us to consult our constituents and be part of that conversation. Pragmatic, experienced legislators gaining expertise from those on the front line so they can make a system work better. Isn't that the way the Senate's supposed to work? Their work shows a lot of promise. There are some very straightforward things that they have heard from those experts. They've heard that we need to lock down the cost-sharing payments. No insurance company is going to be an insurance market if they don't know they're going to get paid what has been promised. Or they're going to raise their premiums incredibly high to cover the risk that they won't get paid. And then, of course, people won't be able to afford that insurance. They heard from the experts that you have to have reinsurance. If you want to have this private marketplace where people can compare policies and use tax credits to buy the policies, an insurance company won't enter that market unless they have their own insurance policy against getting a disproportionate share of the really sick people. So reinsurance, they heard. And they heard that we need to not suppress outreach to those who need insurance, but increase outreach. Outreach to younger, healthier people to make sure they're part of the exchange. Outreach to those who are often working several part-time jobs and have little time to focus on this question unless someone reaches out and says, here's your opportunity. We're now in the open period. Here's how you sign up, and we can make sure that you get that done. You know, that set of hearings heard other things. They heard we need to do more to take on the challenge of mental illness in America. They heard we need to do more to take on drug addiction, opioid epidemic in America. So there it is, a list of a modest number of things that we could do together to make our health care work better. Wouldn't that be a beautiful closing chapter to the nightmare, the repeated horror stories that we've been playing here in the Senate, threatening to rip health care from millions of people? Instead, we awaken from that war over health care and work together to address these fundamental questions. We actually have public hearings in the Health Committee, which we didn't have before. We actually listen to the experts, which we didn't do before. We actually encourage people to consult with their constituents rather than hiding from their constituents. And the result would be a significant strengthening of what we have. Lower premiums as a result, more competition in the exchanges, more awareness of how to sign up, more healthier young people getting involved in the exchanges, which means that the premiums come down. I think as we ponder the goal of our healthcare system, the question of peace of mind, that is our best immediate step forward to provide peace of mind, to end the sabotage of the system we have and address the shortcomings that the healthcare experts and the people of America have pointed out. Let us be that mission statement then, under this vision of a we the people government, that we pursue healthcare designed for the people of America to create peace of mind, that when their loved one becomes ill, that when their loved one becomes injured, they'll get the care they need and they won't end up bankrupt. We should be able to make that happen. Thank you, Madam President.